The new leadership of National Association of Social Workers of Uganda has been tasked to rally social workers across the country to participate in the campaign against the spread of the COVID-19 pandemic. The outgoing president of the National Association of Social Workers of Uganda, Michael Byabakama, wants social workers to participate in sensitizing the public about the advantages of observing the standard operating procedures for COVID-19 prevention.
The new leadership of National Association of Social Workers of Uganda has been tasked to mobilize all the parasocial workers in the country to participate in the campaign aimed at preventing the spread of COVID-19. This follows a report rise in infection rate in the last 1 week. The cumulative cases now stand at 44,594 with 361 deaths, something which is mainly due to the flouting of the set standard operation procedures.
COVID is real, this new wave is real. If we don't do that, the health centers will be overwhelmed. So we need to mobilize so that people go back to SOPs. They don't have to wait to go into ICUs.
The National Coordinator of National Association of Social Workers of Uganda, John Mary Sekate, expressed his readiness to back in the struggle against COVID-19 pandemic.
We partnered up with the Ministry of Health to respond to COVID-19 all quarantine centers in Uganda. Our team was on the front line because we are the expert of behavioral change. We are struggling with an issue of behavior. At the beginning, they looked at it as a political issue. They looked at it as a military issue of enforcing laws. But later on, the government and all other stakeholders, they realized it is a social issue, it is a behavioral issue, and also a psychosocial issue, which requires experts to address that.
Sociologists want social workers' capacity upgraded to enable them to serve in different capacities.
We carried out the research, and we found even in one of the districts, the only social worker they were depending on in the specific location is the hairdresser. Is the one who was receiving people with domestic issues, children violence issues. You can imagine what kind of direction that person can provide. Is not trained for that. So they can cause more harm than good.
The head of sociology at Kyambogo University, Moses Sibalyejusa, acknowledged the gap and emphasized the provision of short courses to retool the social workers.
One of the challenges we have had as social workers, we don't have programs or courses, short courses, to retool the people so that they are able to handle the current social problems or social issues. Because there are certain things that were a problem then, but right now they are not. You are talking about other issues. Before, we used not talk about human trafficking, which has become right now a big thing. You are talking about human trafficking.
This was at the annual general meeting held by the National Association of Social Workers of Uganda to change the leadership of the association. Joseph Okow compiled this report.